Now we're going to talk about another poisoning, and this is the arsenic poisoning. So for arsenic poisoning, we're just trying to look at the acute and the chronic. And for every disease condition, we are trying to talk about acute or chronic. You are just simply trying to talk about this particular disease condition. How long has it been there? So for acute and chronic arsenic is as follows. Well, short time. It has been there for a short time, you say it is acute. It has been there for a very long time, you say it is chronic. So for the acute arsenic poisoning, we said that what the causes is usually because of ingestion of contaminated food or water, accidental or intentional exposure, right? Some people might actually want to commit suicide, so that's an intentional exposure. So symptoms is a lot of disturbances in your stomach, that's gastrointestinal distress, then hypotension and shock due to fluid loss, cardiac arrhythmias, neurological effects such as confusion, seizures, or coma. Okay, so when you say it is acute or occurs ASAP, within a few hours. So how do you treat it? Immediate removal from the exposure. Then you give intravenous fluid, electrolyte corrections. Then you give all those drugs that basically would pick up the arsenic from the system, like the demercaprol, also bowel irrigation. So for the chronic one, it just simply means the person has been exposed to arsenic for a very long time. Okay, maybe contaminated drinking water, so you have been taking it in little amounts, but for a very long time you didn't actually get to notice. Sometimes it's occupational hazard, so you are actually exposed to arsenic in your place of work. So treatment is elimination of the exposure source. Okay, elimination of the exposure source. Then symptomatic management. You will have a lot of issues on the skin, just try to handle them one by one. You will have wounds, you try to maintain the hygiene of the wounds. So symptoms is skin changes, that's all the time hyperpigmentation, or sometimes hypopigmentation, depends. Keratosis and lesions. So peripheral neuropathies like numbness, tingling, weakness, hepatotoxicity and cardiovascular effects. There's increases of the person developing cancers. So endocrine issues like diabetes mellitus. Okay, so when you say something is chronic, that thing has been there and has been moving very small. Okay, so that's what we have for the acute and the chronic arsenic poisoning.